Will your surgical team be with you in the OR the entire time? I'm sure this is a question that really never gets asked by a patient, and certainly no doctor is ever going to volunteer this. It's not something that we think about. We assume that when we go into the OR, that the doctor who's going to operate on us and the anesthesiologist that's going to put us under are going to be with us the whole time. But let me tell you something that you may not know. That may not be always the case, because here's what can happen. The anesthesiologist has many different operations that they're supposed to be responsible for. So they may come in and put you under anesthesia, and when you are under, they're going to leave and they're going to go to the next patient to administer anesthesia to them. And that doesn't mean that you're left unattended, but you're not with an anesthesiologist. You may be with a nurse anesthetist. Now, this is a trained person, but they're not a medical doctor. Also, I've heard of the term revolving surgery. That's a term that I didn't really know what that meant, but I came to learn what that means is that your surgeon may come in and do the complicated part and then move on to another surgery, leaving a junior doctor to finish the operation or do what's called the closing. Now, this is not something that you may be told about, but you should be. When you sign your informed consent, that's the document that allows the doctors to operate on you. I believe they should tell you that they will be doing part of the operation and letting a junior doctor close. And the anesthesiologist should tell you that they are going to be administering the anesthesia, but that they will be leaving the room to do another case, and they will be leaving you with a nurse anesthetist, because you have a right to informed consent. You may agree with these decisions or not. I've had some clients who've told me that they would not have accepted this, that they wanted their surgeon there the whole time. And that's a conversation that they were deprived of having because the decision was really made for them and they didn't have any input. So next time you are going in for surgery, ask your doctor whether they're going to be there the whole time with you. Are they going to be having a junior doctor do any part of the surgery? Are they going to be having the junior doctor close and they're going to be leaving to do another surgery? It's okay to ask your anesthesiologist, will they be with you the whole time? Or will they be doing the anesthesia, leaving the room and leaving you with somebody else like a nurse anesthetist? Remember, this is your right. It's your body. You have a right to ask these questions. And being in the hospital or being around a doctor can for sure be intimidating, and you don't want to ask a lot of questions. I feel the same way. Sometimes I don't want to ask doctors lots of questions, but it's your body and it's your right. I just wanted to give you this information so that you can empower yourself. Thanks for watching this video. If you liked it, please hit that subscribe and the like button at the bottom. That way you can take advantage of all of my videos. I also invite you to my website at frankspectorlaw.com. When you go to my website, I'm going to have lots of free medical malpractice information for you to read that may answer some of your questions about how medical malpractice works. Thanks again for watching this video, and I look forward to seeing you again soon.